What is bronchiolitis? Bronchiolitis is an infection of the lungs, that is, of the lungs, and that affects the respiratory system. This lung infection mainly affects children under the age of 2. It can be caused by different types of viruses. Bronchiolitis is an infection of the lungs, that is, of the lungs, and that affects the respiratory system. This lung infection mainly affects children under the age of 2. It can be caused by different types of viruses. Bronchiolitis can occur at any time of the year, but it appears most often during the winter months, between November and April. Bronchiolitis usually lasts a week, although this does not mean that in some cases there may be respiratory problems, such as colds, shortness of breath, cough. What are the main risk factors? The main risk factor is age. Children under 3 months have a higher risk of hospitalization and, among them, premature babies. Other risk factors are lack of lactation, premature, exposure to tobacco smoke, daycare centers, depressed immune system, underlying heart disease. What are the symptoms of bronchiolitis? Bronchiolitis begins with a cold, runny nose, cough, and sometimes a fever. In some cases, the child may not get worse, or on the contrary, he may cough more, have shortness of breath, wheeze or snore. This is all because your bronchi are clogged with inflammation and disease-secreting mucus. What are the complications of bronchiolitis? The complications of bronchiolitis can be multiple: bluish lips or skin, cyanosis, which is caused by lack of oxygen, apnea, or pauses in breathing, more likely in premature babies and in the first months of life, dehydration, low oxygen levels, and respiratory failure. What are the warning signs that I should be aware of? Once your child has been diagnosed with bronchiolitis and you think it is getting worse, you should return to the pediatrician, especially if you notice any of the following symptoms: vomiting and difficulty retaining liquids, sleeping more than usual, purplish skin color, paleness, sweating. If you don't eat and you get tired. If you breathe worse or faster. If your child is premature or has heart disease. What is the treatment for bronchiolitis? Bronchiolitis is a viral infection, so antibiotics are not helpful. In general, it is a mild illness, but supportive measures can be taken at home. Try to lower the fever. Frequent nasal washings and aspiration of nasal secretions. Keep the child sitting up, as this will help him breathe better. Do not forget that all this is advice that I give you as a pharmacist. I recommend that you always consult your child's pediatrician. If the severity of babies or children is greater, it will be necessary to hospitalize them. How can I prevent the spread of bronchiolitis? Bronchiolitis occurs like a virus and therefore spreads from person to person. Therefore, a good way to prevent it is to wash your hands frequently, and wear a mask. If you have bronchiolitis, you should not mess around the house until it is cured, to avoid spreading it to other babies. Other ways to prevent infection include: if your child is a newborn, especially a premature newborn, avoid exposure to people with colds, especially in the first 2 months of life. Clean, disinfect surfaces and objects that people touch frequently, such as toys and doorknobs. This is especially important if a family member is in lockdown. When coughing, cover your mouth and nose with a tissue. Then discard the tissue and wash your hands. Do not share glasses with other people. Wash your hands and your child's hands frequently. Keep an alcohol-based hand sanitizer on hand for you and your child when you are out and about. Breastfeed your baby if possible. Respiratory infections are significantly less common in breastfed babies. Photography by https://www.q-emergencies.com.ar/q-s-la-bronchiolitis/. An article by Catalina Vidal Ramirez, pharmacist, manager at bio-pharma.es. The information presented in this article is in no way a substitute for the advice of a physician. Any mention in this article of a product does not represent the endorsement of the SDGs, Sustainable Development Goals, for that product.